Hello everyone, welcome to week 14 of Immunology and Serology lecture. For this week, our topic will be about labeled immunoassays. Alright, so at the end of this lecture, you will be able to compare and describe the difference between competitive and non-competitive immunoassays in terms of clinical applications. You will be able to correctly distinguish between heterogeneous and homogeneous immunoassays, explain and describe the different labeled immunoassays in terms of its principal advantages, disadvantages, and laboratory applications. And finally, to decide an appropriate immunoassay for a particular analyte and disease state or condition efficiently. Okay, so to start our lesson, when we say class labeled immunoassay, these are last week, we have discussed different unlabeled immunoassays such as your precipitation reactions and agglutination reactions. So these reactions that we have discussed last time are serological tests, or basic immunological procedures which are fairly simple. They utilize simple techniques to perform, and they require a little way of, or a little way in terms of equipment sophistication. However, these reactions, they are relatively insensitive compared to labeled immunoassays because those reactions rely on a high enough concentration of the unknown, to visualize a specific reaction such as agglutination or precipitation. In contrast, class, with your labeled immunoassays are designed for antigens and antibody reactions that may be small in size or present in low concentrations, in a very low concentrations, which are not detected by unlabeled immunoassays such as precipitation or agglutination, because fairly or mainly those analytes do not have high enough concentration of the unknown to visualize a precipitation or agglutination reaction. That's why these labeled immunoassays are designed for those instances. So, they measure indirectly using labeled reactants, and labeled reactants can be enzymes, it can be radioisotopes, and it can be fluorochromes, So, depende kung ano yung gamit na labeled. And referred to as receptor-ligand assays. Labeled immunoassays are also referred to as receptor-ligand assays. Ligands are known as the substances to be measured and is defined as a molecule that binds to another molecule of a complementary configuration. So basically, class, your label usually binds to the substance that the test is trying to detect. Okay? So that is the receptor. The receptor is what binds to the specific target molecules. Like for example, your labeled analyte or yung label mo is enzyme. Tapos naka-attach yung enzyme sa antibody. So dahil yun yung iyong reagent or yun yung iyong ligand, so yun yung ang ide-detect ngayon nung labeled analyte mo, which is antibody, is the antigen. So usually, the ligand binds to the substance that the test is trying to detect. So madali lang, class, malaman kung ano yung dinedetect ng isang immunoassay. If that immunoassay uses a labeled antibody, the one that is being detected, of course, is patient antigen. And if that immunoassay is using a labeled antigen, of course, the test is detecting patient antibody. Right? So, of course, syempre, kung ano yung na-bind or kung ano yung gamit mong reagent, kung ano yung binabind niya or saan siya nagbabind, that is the one the test is trying to detect. Okay, so labeled immunoassays are designed for antigens and antibodies that may be small enough or may be small in size or present in very low concentration, like what I have said a while ago. So the substance to be measured is known as your analyte, and the one that binds is your ligand. Okay, so one reactant, either antigen or antibody, is being detected or is being labeled with a marker so that the amount of binding can be monitored. So sabi ko nga, if ang analyte or if ang ligand mo or ang may enzyme or ang may labeled or marker mo ay antibody, your analyte or the test will detect antigen. And if you're using labeled antigen, your analyte will be detection of antibody. So it depends upon the type of immunoassay, kung ano yung label niya, at kung ano yung gamit niyang ligand. So, basically class, gumagamit tayo ng label so that ma-detect natin yung small concentration. Like for example, you will put antibody and then you will combine with an antigen. Sometimes the concentrations are very low enough. Hindi mo siya ma-detect with a specific reaction. That's why lalagyan mo siya ng parang ilaw, label, marker. Okay? So lalagyan mo siya ng label na siya ang mag-detect or magdedetermine, no? Siya yung magmamark na merong nangyaring reaction. So, the label can be an enzyme. So, kapag ka enzyme ang gamit, the reaction is a color change. Kapag ka naman radioisotopes ang gamit mong label, of course, when an antigen and antibody combines, there will be a radioactivity. And if the label used is a fluorochrome, of course, if there is binding, there will be fluorescence. So the fluorescence, the color change, and the radioactivity will be the markers of a specific reactions. Because kung walang label, ang hirap makita yung reaction ng combination ng antigen and antibody because it's very low concentration, unlike kapag ka mga agglutination and precipitation, unlabeled immunoassays yon. So in labeled immunoassay, we use this in very low concentrations to detect very low concentrations, and these labels are the ones, no, giving or marking that there is a specific combination that has taken place. Okay, so examples of analytes can include, of course, your bacterial antigens in diagnosis of certain infections and diseases. It could also be hormones, no, identifying hormones or qualitative test for hormones, drugs, tumor markers, no, and other specific immunoglobulins, and other. Okay, and usually, no, analytes can be antibodies, but it can also be antigen. Okay, so either the antigen or the antibody is labeled with a marker so that the amount of binding can be monitored. At kung ano nga yung naka-marker or kung ano yung naka-label, it will bind kung ano yung kanyang dinedetect. Okay? Okay, so what are different constituents of a labeled assay? So first, it could be fluorescent, it could be radioactive or radioactivity, it could be chemiluminescent, or it could use also an enzyme label. Okay? So this assay includes the use of labeled. So ito yung reagent mo, of course, ito yung ilalagay mo, known ito, and you have the patient sample. So non-labeled ligands, specific antibody, standards and calibrators also, and other tests or other immunoassays needs or requires a separation step and means of label detection. It could be using scintillating counter, it could be using fluorescence microscope, or other detection equipments. Okay? So, unlabeled analyte are usually those that might be present in the patient specimens. And also, calibrators or standards, no? These are also unlabeled analytes that are made up in known concentrations of the substance to be measured so that it could be compared, no? The result of their action can be compared to your standards and calibrators. Now, let's go to different format of labeled immunoassay. So, we have two. We have competitive and we have non-competitive. So, madali lang ito, class, no? Any labeled assay could be competitive or non-competitive. When you say competitive, the labeled antigen competes with your unlabeled patient antigen. So your labeled antigen class is your known, with this is your reagent, and your unlabeled patient antigen, this is from the patient sample. So they compete for a limited number of antibody, which is also known or which is on your sample, and then that's why the relationship is inversely proportional because they are competing to the limited number of antibody which is also known. So ano ang unknown mo dito? Patient antigen. And ano yung ligand or ano yung label mo or ano yung reactant mo that is labeled antigen. Okay? So again, there are two major formats for labeled immunoassays. You have competitive and non-competitive. For competitive, the concentration for competitive, the both analytes, labeled and unlabeled analytes, compete with the limited number of antibody binding site. That's why the relationship is inversely proportional. Ibig sabihin, class, kung mas marami yung, for example, ang label na gamit mo is fluorescent or fluorochromes. So, the detection is through the fluorescence that it emits. Okay? So, of course, labeled antigen, dahil siya yung magfa-fluoresce, kapag nag-bind siya sa antibody, the more ang fluorescence na mangyayari. Kaya, ibig sabihin, class, kapag mas mataas yung fluorescence, meaning mas konti yung patient antigen natin. Kasi, sino yung nakabind dito sa antibody, which is also known? Yung ating labeled antigen. And class, kung konti naman ang fluorescence, it means na konti ang nakabind na labeled antigen at ang nagbind is yung patient sample. That's why hindi ganon kadama yung fluorescence. It means higher ang concentration ng iyong patient antigen compared kay labeled antigen. Okay? So in competitive, no, if the concentration of the labeled analyte is in excess, all the binding sites will be occupied. And if patient antigen is present, some of the binding sites will be filled up by your patient antigen or unlabeled antigen, thus decreasing the amount of bound labeled analyte or bound labeled antigen. That's why decrease din ang detection, no? Kung anumang reaction, either fluorescence yan, radioactivity, or color change. Okay? So, this means that the more label detected or the more ang nade-detect na label, no, or yung specific reaction na ine-emit nitong label natin, the lesser ang patient antigen. Lagi niyong tandaan, class, in competitive types of immunoassay, the relationship is always, no, the amount of bound label to the concentration inversely proportional to the concentration of labeled antigen. Okay, so para mas maintindihan, let us take a look at this picture. Alright, so like in this figure, this sample A do not contain unlabeled analyte or wala siyang patient antigen. So, ang laman natin pala, class, muna ng reagent in a competitive immunoassay. So, you have your solid phase antibody or immobilized antibody which is known for the particular antigen or antibody for that particular antigen that you want to detect in the patient. So, nandito yung antibody. Then, of course, you have the labeled analyte. So, itong labeled analyte is a known antigen for this particular antibody. That's why there will be, no, a specific binding. And binding, when antigen and antibody binds, if this is labeled with enzyme, there will be color change. If this is labeled with radioisotopes, there will be radioactivity produced. And if this is labeled with fluorochromes, there will be fluorescence, no, once there is binding. So, depende kung anong type of label yung nakatag dito sa ating known antigen. And in here, you have patient sample or patient antigen, which are unlabeled. So, there will be specific binding. So, allow specific binding. Okay? And then wash to remove the unbound materials or yung mga unbound globulins and antigen. So, at this point, meron na tayong nangyaring specific binding. If there is no presence of patient antigen in the sample, ang magbabind dito sa binding site ng antibody natin are those labeled antigen which are known. Okay? And kung present naman sa sample yung ating patient antigen, magbabind siya doon sa ating antibody. That's why mababawasan yung reaction nung or detection nung labeled analyte natin. Okay? And the signal strength, no, of the reaction of your labeled or the detected labeled reaction is inversely proportional to your patient antigen concentration, no, which means the more labeled antigen is detected, the lesser, no, the patient antigen is present. So, for example, dito, mataas yung radioactivity, mataas yung color product, or mataas yung fluorescence, it means that decreased ang ating patient antigen. Kasi ang nag-combine sa ating antibody are mostly your known labeled analyte. While if patient sample or patient antigen is present, it will combine to the limited binding site of an antibody and lesser yung magiging reaction ng label natin or detection ng label natin. So, kapag ka lesser ang detected na label, it means inversely proportional, it means greater ang presence or activity or concentration ng ating analyte. So, the more the labeled antigen is detected, the lesser ang patient antigen, and the lesser the labeled antigen is detected, okay, the more the patient analyte concentration is present. So that is competitive immunoassay. Alright. Now, in contrast with your non-competitive immunoassay, from the word itself, class non-competitive. So, this means that the amount of label detected is directly proportional to the amount of the patient that is being detected, or if in that case, your patient antigen. So, hindi sila nag-aagawan. So, the label usually is a marker for a specific reaction or combination of a patient antigen and antibody. And usually, no, the label is usually attached to an antibody molecule. Okay? So, how do we do or how do we perform non-competitive immunoassay? So, usually, antibody is first possibly absorbed to a solid phase. So, gumagamit tayo ng solid phase antibody. And the unknown, no, or the analyte being detected is an antigen, which is allowed to react with the antibody that is attached to a solid phase medium. No? So, this usually is often called capture antibody because it captures the specific antigen. And then, a second antibody with a label now will be added, and this one will mark, no, or will be used as a marker to determine if there is a combination of an antigen and an antibody previously. Okay, kung na-catch ba nung antibody yung antigen. Meaning, if nagkaroon ng specific binding or kung present si patient antigen, may pagbabindan yung ating second antibody. That's why the more label is detected, the more patient antigen is present. That's why the relationship in non-competitive immunoassay is always directly proportional to the analyte being detected. Okay? So, para mas maintindihan, let us take a look at this example. Okay, so sample A again is a negative control, and then sample B contains your patient antigen. So, in non-competitive immunoassay class, tandaan nyo, you are using a capture antibody. When you say capture antibody, these are antibodies that are attached in the medium, or what we call solid phase antibody. So, these antibodies, again, are passively absorbed to a solid phase medium, and then these will be the one to capture if there is a specific antigen that is present in the sample. Okay, so sample A do not contain your patient antigen, or do not contain antigen on the sample, and your sample B contains antigen on the patient sample. Okay, so if there is a presence of antigen on the patient, magkakaroon ngayon ng specific binding, or the antibody will capture the specific antigens that are present on the sample. And kung wala namang present na antigen sa sample, of course, walang magbabind dito sa ating antibody. And then, it requires washing to remove unbound materials, or to remove unbound globulins. And finally, to detect a specific reaction, because these, sabi ko nga, sometimes concentrations are very low and there is no visible reaction, or it's impossible to detect visible reaction, we use labels, So, for example, you will add the enzyme that is labeled to an antibody, So, in non-competitive immunoassay, we use labels, attached to an antibody. For example, we use enzyme labeled, Enzyme label detection. So, antibody ang merong label, and that antibody na may label will now attach to the another or different antigenic determinant or epitope of the antigen. That's why non-competitive immunoassay class also requires that antigens should be a multivalent, so that it would be able to attach to two antigen binding sites of an antibody molecule. So, of course, if there is a combination of an antibody, or na-capture ni antibody yung patient antigen, magbabind doon itong ating enzyme labeled or labeled antibody natin. That's why your labeled antibody will serve as a direct marker of your patient antigen. That's why, class, the relationship is directly proportional. So, kung higher ang activity ng enzyme, or merong color change, increased color reaction have occurred, it means that there is a higher concentration of your patient antigen. And syempre, kung walang patient antigen sa sample, wala ring pagbabindan itong ating enzyme labeled antibody or labeled antibody natin. That's why walang mangyayaring detection of the label or label detection. That's why kung wala, it means there is no, or negative, there is no presence ng ating antigen doon sa ating sample. Okay? So, directly proportional ang relationship, meaning the more amount of label is detected, the higher the amount of the patient antigen. And the lesser amount of label detected, meaning there is no antigen, or decrease ang presence ng ating antigen. And this type of assay is more sensitive than your competitive immunoassay. So, ulit, class, for competitive, you use a labeled antigen, and we are detecting patient antigen. So, parehong antigen, That's why the relationship is inversely, kasi nag-aagawan sila. So, kung more ang na-detect na labeled antigen, it means konti si patient antigen. That's why inversely proportional ang label detection to the patient that is being detected, or the patient analyte that is being detected. In non-competitive immunoassay, the relationship is direct. Why? Because we use labeled antibody. capture technique, no? So a first antibody is absorbed into the solid phase. It will capture the patient antigen, and a second antibody, which is labeled, will serve as your marker for specific reaction. That's why the higher the label detected, higher ang patient antigen. And the lesser the label detected is, the lesser the patient antigen concentration is. Alright? So that is competitive and non-competitive. Ito na rin class yung competitive and non-competitive ELISA. No? You will just use enzyme as your label, and the reaction is a color change. So for competitive ELISA, the more color change means the lesser patient antigen, and for non-competitive ELISA, the higher the color change reaction or the higher the color intensity, the higher the patient antigen is detected or present. Okay. Next is separation technique. So, we have different also techniques, no, in performing the labeled immunoassay. When we say heterogeneous class, it requires a separation. So, it requires washing, no? And if the test uses homogeneous enzyme immunoassay or homogeneous immunoassay, there is no need for a separation step, and thus it is simpler to perform. Okay, so this is an example of a heterogeneous immune assay wherein hindi na tayo gumagamit ng separation technique. And it provides a simple way, no, to separate bound and free reactants. Okay, so again, heterogeneous does not require a step to physically separate from bound and analyte, and usually heterogeneous enzyme immunoassays or heterogeneous immunoassays uses adsorption, wherein when binding takes place, complexes remain attached to a solid phase medium, and this nga provides a simple way to separate bound and free reactants. And then the sample is then thoroughly washed to separate free from unbound analyte, and the remaining activity is determined. While homogeneous enzyme immunoassay, this is an example of an homogeneous enzyme immunoassay wherein it does not require a separation step and is simpler to perform. Okay, and usually the sample containing a patient antigen is incubated with a labeled antigen, okay, and an antibody. So, for example, in this figure, no, so we have a reagent antibody is in solution, and patient antigen and enzyme labeled antigen competes, no, to the limited binding site. Okay, and when patient antigen is present, the enzyme label on the reagent antigen is not blocked, so color development will be observed. Okay, so sabi ko nga, this is an example of a competitive immunoassay. While in sample A, it has a low concentration of patient antigen, whereas in sample B, it has more patient antigen and has a stronger color development if the enzyme used is enzyme, no? So, the more ang ating label detected, the lesser ang ating patient antigen. So, kapag more or stronger ang color development, it means that the concentration of patient antigen is low, while sample A has more signal or color change or signal that is being produced or color change, since most of the antigens bound are labeled antigens. And of course, if mas marami yung patient antigen, inversely proportional, so meaning less yung ating label detected. Okay, so that is your separation techniques. Again, heterogeneous require a separation or washing, and homogeneous does not require a separation technique. Usually, if they are using solid phase, it requires washing or heterogeneous enzyme immunoassay type siya. Okay, now, let's discuss the three different labels that we use. Of course, we use radioisotopes, we use enzyme, and we use fluorochrome. So, number one, let us first discuss those labels using radioisotopes, and that is known, or the test is known as radioimmunoassay. So, going back to our history, the first type of labeled immunoassay developed was radioimmunoassay, which was pioneered, of course, by Rosalind Yalow and Burson in the late 1950s, no, if you can remember. It was used then to determine the level of insulin and anti-insulin binding complexes in diabetic patients. So this technique is very valuable in measuring a number, no, of substances such as your hormones, your serum proteins, antibodies, immunoglobulins, or vitamins, no, that are either or occur at very low levels. That's why we use labeled analytes to mark, no, or to detect those very low concentrations that cannot be detected by agglutination and precipitation reactions, no, because their amount in blood plasma are very small, so they could not be detected otherwise. That's why those analytes, no, that is found to be very low in our blood plasma or blood serum are usually detected by labeled immunoassays. Okay. So again, radioimmunoassay uses a radioactive labeled substance. So we use radioactive substances as our label, and because our label are radioisotopes, the label or the detection or yung reaction na dinedetect, no, if there is binding, no, of an antigen, or there is an antigen antibody complex, there will be an increase in radioactivity. So radioactivity means that there is a specific binding, and these can be measured using a scintillation counter. Okay, so usually radioactive substances are very easily, or they are easily incorporated into protein molecules, and it emits a gamma radiation detected by scintillating counter or gamma counter. And very low quantities of radioactivity can be easily measured. That's why this is widely used. Okay, several also radioactive labels including 131 iodine, 125 iodine, trishaded hydrogen, no, or trishaded hydrogen have been used, no, but the iodine 125 is the most popular among them. Okay, RIA or radioimmunoassay class is very sensitive and precise, no, for determining trace amounts or small amounts of analytes, no, in our blood plasma. However, there is a chief disadvantage of these immunoassay, and that is it's a major health hazard, which involves radioactive substances, and it could cause several cell, no, disorders, no, and it could be carcinogenic and harmful, no. Of course, radioactivity or radiation is really harmful, no, and can cause different consequences. Okay, and aside from that, no, which is the major disadvantage, also disposal problems, mahirap at may kailangan tayong sundin EPA guidelines, no, in disposing the radioactive substances. And radioactive substances also has a short shelf life, and of course it needs an expensive equipment. Okay, that's why it is not often used or routinely used in different laboratories. Okay, so laboratorians often they tend to use other labeled immunoassays, no, in identifying those analytes in low concentrations. Alright, so as I have discussed a while ago, radioimmunoassay can be competitive or non-competitive. Okay? Okay, so halos pare-pareho lang to class. Competitive and non-competitive principles, papalitan mo lang yung gamit mong label. So if ang gamit mong label is radioactive substance and you are using competitive binding assay, that is competitive RIA. If you are using um, radioactive substance and it is attached to a labeled antibody, that is non-competitive RIA or what we call IRMA. And if you're using enzyme instead of radioactive substances, that is competitive ELISA. And if you're using enzymes attached to an antibody, that's non-competitive ELISA. So pare-pareho lang sila ng principal class. It's either competitive or non-competitive. And kung ano yung gamit na label, of course, that is a type of immunoassay. So in competitive RIA or competitive radioimmunoassay, kagaya lang to nung competitive binding natin. So you are using a radioactive labeled antibody which competes to our patient antigen. Okay? That's why the amount of label that would be detected is inversely proportional to your patient antigen. So meaning class, if little or no antigen is present in the patient, ibig sabihin walang antigens, ibig sabihin there would be a strong positive reaction of radioactivity. Why? Kasi ang nag-cause ng activity is our radio-labeled antigen, which is our reagent, no? Doon sa ating known antibody din. Okay? And if there is a lot of patient antigen that is present in the sample, it will successfully bind in large quantities in our high affinity limited binding sites of an antibody and thus causing a decrease in the binding of our radio-labeled analyte, causing decrease in color or radioactivity, not color, no? Because we are talking about radioimmunoassay. So there would be a decrease in radioactivity, and this would be determined using a gamma counter or scintillating counter. So tandaan, the reaction of competitive RIA is always inversely proportional. You're using, tandaan nyo kung anong gamit na label at kung ano yung dinedetect ha. So you are using a labeled or radioactive labeled antigen that would detect patient antigen. Okay? And ano pa yung reagent mo? You have your high affinity antibody molecules. Okay? In non-competitive or IRMA, kamukha lang din nung kanina, no, sa non-competitive assay or sa example natin, sa non-competitive binding assay, palitan mo lang ng radioactive substance yung enzyme. That's why ang nakabound dun sa second antibody natin is radioactive substance. Diba kanina, there is a first antibody which is attached on the solid phase medium. It will capture the antigen, and a second antibody which is labeled with the radioactive substance will be incorporated. Thus, the radioactivity that would be detected is directly proportional to the patient analyte. So you are still detecting patient antigen, in non-competitive RIA. Okay. Next, let us now go to enzyme immunoassay. So same lang halos nito class, kapareho lang kay RIA, but papalitan lang natin ang label na gamit natin as enzymes. Okay? So, kapareho lang din, we detect or we use enzyme immunoassays in those analytes that occur at a very low amount or concentrations in our serum and could not be detected. That's why we use certain labels such as enzyme, to detect these reactions. And as labels for immunoassay, of course, your enzymes are relatively cheap, they are readily available, and they have a long shelf life. That's why enzyme immunoassays are the widely used immunoassays up to date. So they are easily adapted to automation. They cause changes that can be measured using inexpensive equipment. That's why it is more preferred. It is more preferred and routinely performed in different laboratories. Okay, so and because RIA is, although it is very sensitive, RIA has a chief disadvantage as a health hazard, as well as the different expensiveness, short half-life, no, and disposal problems. That's why enzyme labels are developed, no, were developed as alternatives to your RIA. Okay. Enzyme labels can either be used qualitatively, meaning to detect lang presence or absence, or determine the presence of an antigen, to determine the presence of an antigen or antibody, or quantitatively to determine the actual concentration of an analyte in an unknown specimen. So it depends upon the type of activity. So class, these are enzyme leak immunosorbent assay, or what we call as ELISA. And these is designed, of course, to detect antigens or antibodies, no? And the detection or the reaction that is produced or is being produced is an enzyme triggered color change. So if your radioactive or immunoassay is of course, radioactivity measured by scintillating counter in enzyme immunoassay, a reaction, no, is detected via an enzyme-triggered color change. Okay, and usually enzymes are readily available. They are naturally occurring molecules that catalyze certain biochemical reactions, and they react with suitable substrates to produce breakdown, no, of the certain products, and may be chromogenic, fluorogenic, or luminescent. That's why there would be an enzyme triggered color change after a specific reactions. Okay, and the use of enzymes as labels typically are chosen according to their number of substrate molecules that is converted, no, the ease of use, the speed of detection, and stability of enzymes. And your enzyme immunoassays can be classified as either heterogeneous, kagaya nga nung diniscuss ko kanina, which involves washing, and homogeneous, which do not require a separation method. Okay, so enzyme assays could be classified as either heterogeneous or homogeneous on the basis as to whether they need a separation process or not, as previously mentioned a while ago. So sabi ko nga, the enzyme chosen differ, no, or depends upon several factors as mentioned a while ago, and typical enzymes that have been used as labels in colorimetric reactions include horseradish peroxidase, glucose oxidase, G6PD, alkaline phosphatase, and beta-galactosidase. Okay? Your horseradish peroxidase and your alkaline phosphatase have the highest turnover, no? They have the highest turnover rates, and they also have the highest sensitivity, and they are very easy to detect, so they are most often used in laboratories, your horseradish peroxidase and your alkaline phosphatase. Okay, now let's move on to the different types of ELISA or enzyme immunoassay. So sabi ko nga, an enzyme immunoassay can be classified as heterogeneous enzyme immunoassay or as a homogeneous enzyme immunoassay, depending as to whether they need the air washing, no, or separation technique or not. So heterogeneous enzyme immunoassay requires washing, careful washing to remove any non-specifically bound antigen. Okay, and then enzyme activity is then be determined. So number 1, heterogeneous enzyme immunoassay is competitive ELISA or competitive enzyme immunoassay. So ito rin class yung diniscuss ko kanina sa competitive immunoassay, palitan mo lang yung label ng enzyme. So instead of same ni competitive RIA, but you are using enzyme as your label. That's why you use enzyme labeled, which is attached to our known antigen, and that competes with our patient antigen for the limited binding sites of our known antibody molecules that are attached to a solid phase medium. So, meaning class, kapag ka mas marami ang enzyme-labeled antigen na naka-attach sa antibody natin, it means konti si patient antigen kasi ito ang nag-bind. And kung konti ang nag-bind na enzyme-labeled antigen, it means marami ang patient antigen. That's why the enzyme activity is inversely proportional, which means no, that the more patient antigen is bound, the less enzyme label is detected. And the higher enzyme label is, the higher color change, no, or color reaction, no, or stronger color reaction is detected, meaning the lesser our patient antigen is. Okay? And this method is typically used for measuring small antigens that are relatively pure, such as drugs and hormones. So that is your competitive ELISA. So you use solid phase antibody, and then lalagyan mo na ngayon ng antigen, which is yung reagent natin, which is enzyme labeled, and the unlabeled patient antigen. Alright? And your enzyme labeled antigen competes with your patient antigen. So, pagka mas marami ang reaction or detected natin na label detected, meaning konti ang ating antigen sa sample. At kung konti ang reaction, meaning ang nakabind sa antibody is ang ating patient antigen. Kasi wala nang available binding site, that's why hindi na nakabind ang ating labeled antibody. Okay? For our non-competitive ELISA, so same pa din doon sa kanina, no? So we are using now an enzyme-labeled antibody. So often, this is referred to as indirect ELISA because the enzyme-labeled reagent does not participate in the initial antigen-antibody binary reaction because we uses a first antibody which is attached to a solid phase, right? And then you will add the multivalent antigen in a second enzyme-labeled immunoglobulin or enzyme-labeled antibody will be added. So, it will then be added, and it will, or the amount of enzyme labeled is directly proportional to the amount of the test substance. So, class, parang similar lang to sa capture. Correction pala, yung sinabi ko kanina, solid phase antigen ang gamit natin for non-competitive. Yung solid phase antibody is for the capture. So, pareho lang sila or pareho lang to non-competitive immunoassay or also known as indirect ELISA. So, in indirect ELISA class, para mas malinaw, we use a solid phase antigen instead of a solid phase antibody. Yung solid phase antibody ay kay capture ELISA or capture or sandwich ELISA. So, in indirect ELISA, you use solid phase antigen, okay? And then, you will now detect, dahil tayo ay gumagamit, so ito yung pang-capture natin. Of course, we will detect patient antibody. So, ang kabaligtaran ni sandwich, we detect multivalent antigens, right? So, in non-competitive ELISA or indirect ELISA, we use solid phase antigen. So, known ito for the antibody that is being detected. So, i-combine sa sample, and then a specific binding will take place. Okay? And then, you will add an enzyme-labeled anti-immunoglobulin. Pakitandaan, in indirect ELISA, your label is attached to anti-immunoglobulin or AHG. Okay? So, if there is a specific or if the patient antibody is present, no, in the sample, there will be specific antigen-antibody binding. That's why merong mapagbabinda ng ating enzyme-labeled anti-immunoglobulin. No? Siyempre, kasi kung present yung antibody, may mapagbabinda ng ating anti-immunoglobulin and there will be a specific color reaction. That's why still, this is a non-competitive assay, meaning the label detected is directly proportional to the amount of the patient analyte. Okay? So again, antigen is typically bound to a solid phase, no? And then, an unknown antibody will then be added and given time to react. If antibody is present in the patient, there would be a specific binding. Okay? And then, the tube is washed to remove unbound antibody or unbound analytes. And after washing, an enzyme labeled anti-globulin or anti-immunoglobulin, so antibody against human globulin, or a second antibody, no, will be added, which is tagged with enzyme. So this second antibody now, which is anti-immunoglobulin, will react with any patient antibody if there are present. Okay? If no patient antibody is present, or is bound to the solid phase antigen, the second antibody or the enzyme labeled anti-immunoglobulin will not be bound. That's why there will be no enzyme activity or luminescence or color change or fluorescence, whatever may be the enzyme reaction. Okay? So, this would be measured using a detection device compared with a standard curve. So, the amount of the color change, no, the fluorescence or luminescence detected is directly proportional to your antibody that is present in the specimen. So, if walang antibody that is present, walang mapagbabindan to, so there would be no color change, fluorescence, or luminescence that would be detected. So, that is your indirect ELISA or non-competitive ELISA. Okay, and the next type of heterogeneous enzyme immunoassay is capture assay. So, this is also a non-competitive technique wherein you will use naman an antibody or solid phase antibody. So, ito yun class yung kaninang example natin sa non-competitive immunoassay. So, we use antibody that is absorbed to a solid phase medium, and you will also use, or it also requires antigens that have multiple binding sites or multiple epitopes so that it would be able to bind the two antibodies. Okay? After incubation, enzyme labeled antibody will then be added. So, kung ang indirect ELISA, you use labeled anti-human globulin, capture ELISA or sandwich ELISA uses enzyme labeled antibody. And competitive ELISA uses enzyme labeled antigen. So, tandaan kung ano yung analyte, kung ano yung labeled, no, na analyte, and kung ano yung dinedetect sa sample, no, or ano yung known analytes natin. Okay? So, after incubation, enzyme labeled antibody will be added, no? And this second antibody may recognize same or different epitope than the solid phase antibody. And thus, your enzyme activity is directly related to the concentration of the antigen. So, sandwich ELISA also detects antigen present in low concentrations and suited to antigens with multiple epitopes. Okay? Alright, so again class, if antibody is bound to the solid phase rather than an antigen, this is called sandwich. If antigen is bound to the solid phase, that is called indirect ELISA, and both of which are using non-competitive immunoassay binding principle, which is the label or the label activity is directly related to your analyte. Okay? And tandaan din, in capture sandwich, the antigens should be or should have multiple epitopes. So, it detects patient antigen and multiple epitopes. Okay? So, in sandwich ELISA, we use solid phase antibody instead of solid phase antigen, and we detect patient antigen. Okay? And then there would be specific binding if present ang antigen sa ating sample, and a second antibody which is labeled with enzyme will be added, and if there is a presence, no, of patient antigen in the sample, may mapagbabinda ng ating enzyme labeled antibody. Okay? So, your first antibody, which is our solid phase antibody, will capture, kaya nga siya capture assay, it will capture the multivalent antigen, no, or antigens with multiple epitopes, And dahil na-capture na siya, mas madali na siyang i-bind ng second antibody natin, which is labeled with enzyme. Thus, the enzyme activity is directly proportional to your patient antigen. Why? Because if there are no presence of antigens in the sample, your enzyme-labeled antibody will not be bound and there will be decrease to no change in color, luminescence, or fluorescence. And there would also be, this is an heterogeneous assay, that's why there is a washing, no, that is required. So, halos pareho lang to class ng indirect ELISA. Ang kinaiba lang is gumagamit tayo ng solid phase antibody and we're detecting patient antigen, and the labeled analyte is an antibody. Right? So, that is your capture ELISA. And capture ELISA is best suited to antigens that have multiple determinants, such as your immunoglobulins, your cytokines, protein, tumor markers, other bacteria, especially your viruses. Okay, so depending upon the particular enzyme used, either colored or chemiluminescent reaction will be detected. And enzyme activity is directly proportional to your amount of patient antigen in the sample. Okay, so that is sandwich. Okay, so short recap, competitive ELISA uses labeled antigen and competes with your patient antigen, inversely proportional. Your indirect ELISA and capture ELISA uses non-competitive binding principle wherein directly proportional ang label detected to the patient analyte. In indirect ELISA, you're using a solid phase antigen, no, instead of a solid phase antibody, and you're detecting a patient antibody, and you use enzyme labeled anti-human globulin. In capture or sandwich ELISA, you use solid phase antibody and you detect patient antigen, and you're using enzyme labeled antibody as your marker, and both of which the action of the enzyme activity is directly proportional to the patient analyte in the sample. Okay, so that is for heterogeneous binding assay. For homogeneous enzyme immunoassay, so these reagent or these immunoassay do not require, no, a separation method, and usually they are less sensitive than your heterogeneous assays but are rapid, simple to perform, and adapt easily to automation. Their chief use has been in determination of low molecular weight analytes in both serum and urine. Homogeneous assays are based on the principle of change in enzyme activity as specific antigen-antibody combination occurs. And of course, enzyme activity is directly proportional to the concentration of your patient antigen or hapten that is present in test solution. Most frequent enzymes that are used for homogeneous enzyme immunoassay include malic dehydrogenase and G6PD. Okay, and examples of or advantages, no, of enzyme immunoassay as compared with urea includes it has a sensitivity which is similar to urea without creating a health hazard or disposal problems, and it has shorter incubation time, no need for expensive equipment, and the reagents have long shelf life. While anong disadvantage niya, some specimens may contain natural inhibitors of enzymes, thus it could also cause false negative reactions, and non-specific protein binding may occur with our enzymes. Okay, so that is for our homogeneous enzyme immunoassay. Now, we also have rapid immunoassays. Ito yung mga nasa ating test kits which are designed primarily for point of care or home testing. Okay, but many of these have been modified for increased sensitivity and can be made semi-quantitative for use in clinical laboratories. And typically, your rapid immunoassays are designed as single-use, disposable, no, in a plastic cartridge, no? And these are also known as membrane-based cassette assays. So these are rapid, they are easy to perform, and give reproducible results. They are also designed as single-use, and the membrane is usually made of a microporous nylon, which is able to easily immobilize the proteins or nucleic acids. Okay, and the rapid flow through the membrane and its large surface area enhance the speed and sensitivity of ELISA reaction. So either antigen or antibody can be coupled to the membrane, and the reaction is then read by looking for the presence of a colored reaction product. Okay, so some some test device require the separate addition of a patient sample, wash reagents, labeled antigens, antibody, and substrate. So this is an example of a membrane cassette or membrane-based cassette assay. So depending upon the test, either antigen or antibody can be tagged, no, with the label, and it could detect either antigen or antibody depending on the test, no, and reagents. Then next we have your immunochromatography, no? So same lang din, ito rin kadalasan yung principle ng ating mga rapid immunoassays, wherein it combines all the previously mentioned steps into one. Okay, so the analyte is applied at one end of the strip, and and migrates toward the distal end, no, wherein where there is an absorbent pad. Okay, there is an absorbent pad to maintain a constant capillary flow rate. Okay, so dito magpapatak dito sa one end, and migrates toward the distal end where there is an absorbent pad to maintain a constant capillary flow rate. Okay, so the labeling and the detection zones are set between the two ends. Okay, so for example, we will be detecting in the sample antigen. That's why we will be using a labeled antibody, no, because we're detecting patient antigen. So kung detect mo is antibody, you will be using labeled antigen. So depende sa test. So for instance, we are using or we're detecting patient antigen from the clinical sample, and then as the sample is being loaded, it will be or it will combine and form complex with our labeled antibody. Okay, so it will form complex towards the detection zone. So there would be a specific combination with an antibody, your antigen and antibody combination. There will be specific combination moving along by capillary flow to the detection zone. So kapag ka-present sa ating sample yung antigen, magkakaroon ng specific binding. And here, if this is detecting antigen, so there would be a monoclonal antibody or an antibody immobilized in the detection zone, captures the immune complex and forms a colored line for a positive test. So dito magkakaroon ng colored line. So an immobilized antibody in the detection zone captures the immune complex if there is presence and forms a colored line for a positive test which may be formed. Okay, and the excess antigens and antibodies or excess labeled immunoreactants will be migrated or will migrate to the absorbent pads. Okay, so this is a type of a test device has been used widely not to identify different microorganisms particularly your Streptococcus pyogenes, and also used for pregnancy for HCG, immunochromatography, and other testing kits for cardiac troponin, no, and other hormones. Okay? So test results are most often qualitative, no? A formation of a line, no, indicates positive rather than a quantitative reaction. So that is your rapid immunoassay. And now, let us move on to fluorescent immunoassay. For fluorescent immunoassay, pareho lang din to ni Ria, ni Eliza, competitive and non-competitive. And palitan mo lang ng label. So, in fluorescent immunoassays, we use fluorochromes as our label. So, ganun pa rin, it detects substances in our blood plasma that occur at very low levels, no? So, they can be detected. Okay? So, Albert Kunz was the one who demonstrated that antibodies could be labeled with molecules that fluoresce, and that is known as fluorophores or fluorochromes. Okay? So, two compounds most often used are your fluorescein and rhodamine. So, these fluorochromes and fluorophores can absorb energy from an incident light and convert that energy into light that is of longer wavelength and lower energy as it excites, no, and return to the ground state. And usually fluorophores are typically organic molecules with a ring structure. Okay, and each fluorescent compounds has a characteristic optimum absorption rate, so they are absorbed in different nanometers, and time interval between absorption of energy and emission of fluorescence. So, ano ang dinedetect, mini-measure natin in fluorescent immunoassay? We are measuring absorption and emission of fluorescence, no? And can be measured in nanoseconds. Okay? So, other compounds used, no, as fluorochromes also are your phycobiliprotein, your europium, and Lucifer yellow VS. Ideally, fluorescent probes should exhibit high intensity, which can be distinguished easily from background fluorescent. And fluorescent compounds should also be stable. Okay, so ano nga yung pinaka-common na ginagamit natin? We have fluorescein and rhodamine. So the two compounds or these two compounds are most often used, no? And usually in the form of isothiocyanates, because these can be readily coupled with an antigen or antibody. So your fluorescein isothiocyanate absorbs maximally at 490 to 495 nanometers and emits a green color at 520 nanometers. Again, your fluorescein absorbs maximally at 490 to 495 nanometers and emits a green color at 520 nanometer. It has a high intensity and good photostability and high emission yield. While your tetramethylrhodamine or your rhodamine, no, usually in the form of tetramethyl or coupled in tetramethyl, absorbs at 550 nanometers and emits a red light at 585 nanometers. Again, usually rhodamine is in the form of tetramethylrhodamine, which absorbs light at 550 nanometers and emits red light at 585 nanometers. So, these two compounds have different absorbance and emission patterns. That's why they can also be used together. Okay? So, Your fluorescent immunoassay can be categorized as either direct or indirect depending on whether the original antibody has a fluorescent compound tag that is attached to it. Okay, so dalawang klase ang fluorescent immunoassay natin, class. Which are commonly used. We have direct and indirect immunofluorescent assay. So madali lang to, class. Ang tatandaan nyo lang dito, class, indirect immunofluorescent assay, you are detecting patient antigen, and in indirect immunofluorescence, you're detecting patient antibody. So how do we perform this? So your patient antigen is directly fixed into a microscope slide. And then, an antibody which is labeled with a fluorescent tag will then be added. So, directly, it will, if present, sa sample, yung antigen, the antibody conjugated with a fluorescent tag will directly bind the antigen, and there would be a fluorescence that would be detected using a microscope. Okay, that's why the relationship is, of course, directly proportional. Okay, so antigens are typically visualized as bright apple green or orange yellow objects against a dark background. So ulit, antibody that is conjugated with the fluorescent tag is added directly to an unknown antigen that is fixed to your microscope slide. After incubation in a washing step, the slide will be read using a fluorescence microscope, and antigens visualized as bright apple green or orange yellow objects. And usually, examples of antigens that are detected using direct immunofluorescence are your Legionella and Chlamydia trachomatis. While in indirect naman, class, so diretso, antigen nakalagay, lalagyan mo ng sample yung slide which has the unknown patient antigen, and directly add ka ng antibody which is labeled with a fluorescent tag. The relationship is proportional. So, if there are presence of antigens in the sample, may pagbabindan yung known antibody mo for which you are detecting, or for what antigen you are detecting, and magkakaroon ng fluorescence. Okay, so fluorescence means there is presence of patient antigen. While in indirect immunofluorescence, tandaan nyo naman dito, tatlong patong sila. Kung sa direct immunofluorescence, antigen on the slide, and then antibody will bind, and fluorescence will happen if there is presence of antigen. So, ganun ka-direct. For indirect immunofluorescence, tatlong patong ang mangyayari. So, in the slide will be, or you will fix, or ang nakalagay sa slide dito is known antigen because we are detecting a patient antibody. Okay, so this involves 2 steps, kaya tatlong patong. So, the first of which is incubation of your patient sa room wherein you are detecting patient antibody. And ang nakalagay sa slide mo ngayon, or a solid phase medium mo sa slide, is a known antigen. Kanina, kay direct, ang ilalagay mo sa slide is patient antigen, and mag-a-add ka ng fluorescent tag na antibody. And then, diretso i-read. For indirect, lalagay mo sa slide is known antigen, and then you will add or incubate with patient sa room wherein it contains your patient antibody. Then it will be allowed to be, you will incubate and wash, and then to determine if there is specific binding between the known antigen and the patient antibody, you will then add an anti-human immunoglobulin, which is labeled with the fluorescent tag. If there is presence of patient antibody that is combined with our known antigen, your anti-human immunoglobulin will be bound to it. Thus, a localized fluorescence will be detected. So, para mas maintindihan natin, ito yung ating indirect immunofluorescence. So, it involves a 2-step process wherein i-combine mo muna yung ating, ito yung indirect immunofluorescence. This is direct immunofluorescence. So, punta muna tayo kay indirect immunofluorescence. So, here are your known antigen for which yung dinedetect natin yung antibody. Kung ano yung antigen, kung ano yung dinedetect nating patient antibody. So, known antigen on the slides, then add patient serum. If present sa patient serum mo yung antibody for this particular known antigens, there would be specific binding. That's why if you add now your reagent, which is an anti-human immunoglobulin with a fluorescent tag, there would be fluorescence. That's why pareho lang din, the fluorescence is directly proportional to the amount of analyte. So, this is for your indirect. Antigen, patient antibody, and then a second antibody, which is your anti-human globulin, which is, syempre, magbabind sa FC portion ng ating human antibody kasi nga anti-human immunoglobulin siya. While as for the direct immunofluorescence, as easy as this one. You are detecting patient antigen and then you will add fluorescent labeled antibody. Okay? If specific antigen is present in the patient sample, fluorescence will be observed. For indirect, it requires two-step. You will add first your known antigen on the slide and then patient serum will be added, specific antibody for this antigen. If there is specific antibody for this antigen, there would be a binding, no? And then wash, and then add a labeled anti-human globulin labeled with fluorescent, and then fluorescence of the sample will be determined. So the amount of fluorescence is directly proportional to the patient antibody that is present. So that is your indirect immunofluorescent and direct immunofluorescent. Indirect or IFA is usually used for Treponema pallidum, which we will discuss next week. Okay? And last type of fluorescence immunoassay is your fluorescence polarization immunoassay. So this is based on the change in polarization of fluorescent light emitted from a labeled molecule when it is bound by an antibody. So if a molecule is small and rotates quickly enough, the emitted light is unpolarized after it is excited by a polarized light. And if the labeled molecule is bound to antibody, the molecule is unable to tumble as rapidly and it emits an increased amount of polarized light. So the degree of fluorescence polarization is inversely, tandaan ha, inversely proportional to the concentration of the analyte. So para mas maintindihan, tignan natin tong picture. Alright. So in fluorescent polarization immunoassay, reagent antibody and fluorescently labeled analyte, so ito yung fluorescent labeled analyte or antigen, are added to the patient sample and we're detecting patient antigen kasi we're using reagent antibody. Okay, so if a sample analyte or patient antigen concentration is low, the antibody will bind most of the labeled analyte or fluorescent labeled analyte, restricting its rotation as seen in letter A. And when excited by polarized light, the emitted fluorescence will remain polarized. Pag sinabi nating remain polarized or increase ang polarization, the light waves are with the same direction or orientation. That's why if increase ang polarization, it means na konti ang ating patient antigen in the sample. While as seen in letter B, if the patient, ito yung unlabeled natin, no, or the unlabeled analyte has a high concentration, this unlabeled analyte will take up or occupy most of the antibody binding sites, leaving the labeled analyte free Okay, leaving the labeled analyte free to rotate. That's why the light waves emitted by the rotating label analytes or labels will not be uniformly oriented, meaning it has less polarization. So, hindi magiging uniformly oriented. That's why, if less ang polarization, it means that free ang mga labeled analyte natin. That's why not uniformly oriented sila and less polarization. It's because most of the patient analyte is bound to the antibody. Okay? So again, kapag mataas ang polarization, meaning the light waves all oscillate with the same direction, it means na ang nakabind sa antibody is the fluorescent tag analyte kasi hindi sila free to rotate, and if they are not free to rotate, they oscillate in the same direction. That's why increase ang polarization. And if hindi sila free, it means nakabind sila dun sa antibody, and that means konti ang nagbind na patient antigen. That's why the relationship is inversely proportional. While if the patient sample or patient antigen is in increased concentration, sila yung magbabind kay antibody, and the labeled analyte or fluorescent analyte will be free to rotate and be and less uniformly oriented. So, free sila. That's why, hindi uniform ang orientation. That's why less ang polarization. Okay? If the light or the light waves emits with the same orientation, it means higher ang polarization. And if they are not uniformly oriented, less ang polarization. And nangyayari yon kapag free ang ating mga rotating labels. At kailan nangyayari yon? If marami ang ating patient antigen. That's why less polarization, tandaan na, less polarization means higher antigen or analyte concentration, and higher polarization means lesser ang patient antigen concentration. Alright? And lastly, we have the chemiluminescence or chemiluminescent immunoassays. So, chemiluminescence are emissions of light caused by chemical reaction, typically an oxidation reaction producing a molecule that decays back to its original ground state. So, molecules capable of chemiluminescence include luminol, acridinium esters, ruthenium derivatives, and nitrophenyl oxalates. So when these substances are oxidized, typically by hydrogen peroxide, intermediates are produced that are of higher energy states. And these intermediates spontaneously return to their original state, giving off energy in the form and light. And that light emissions are the ones that are being measured. So light emissions range from a rapid flash of light to a more continuous glow that can last for hours. So your acridinium esters, for example, emit a quick burst or flash of light, while the light remains for a longer time with your luminol and dioxetane derivatives. Okay, so that is for chemiluminescence. Alright, so that ends our discussion for labeled immunoassays. For any questions or clarifications regarding this lecture, please don't hesitate to send me a message on my email or send me a private message through my Facebook Messenger, or you could enter our Google Meet link on your session 3 schedule. Okay, also, please prepare for an assessment task next meeting on your session 1. So I hope, class, everything is clear with our lecture. I hope that you have understood well. For any questions, please reach me through the contact details provided. So with that, thank you guys for listening, and see you on our next discussion.